Symmetry OCD, what it is, symptoms, and treatment. Hi, I'm Michelle Risser, and I'm a licensed therapist, and today we're going to go over Symmetry OCD. In this video, we'll go over the definition of Symmetry OCD, we'll talk about Symmetry OCD's symptoms, we'll discuss examples of Symmetry OCD, and we'll go over how to get treatment for Symmetry OCD. First, what is Symmetry OCD? Symmetry OCD is all about the need for sameness or the perfect arrangement of objects. This can create anxiety about things not feeling or being quite right. That feeling experienced by OCD can cause a sense of dread. Someone with Symmetry OCD will view their environment as cluttered or disorganized until things are put in perfect order. This is not just a desire for things to be neat and tidy. A person with Symmetry OCD knows that their fear is irrational, but they have difficulty thinking about anything else until that feeling is resolved by performing compulsive acts to fix it. Research has shown that about 36 to 50% of people with OCD have this subtype. Symptoms of Symmetry OCD. Symptoms are similar to OCD symptoms of just right OCD and perfectionism in OCD. Some experience a sense of superstition or over-responsibility, like if they ignore a feeling that something is out of place, something bad will happen. Others may not necessarily have obsessive thoughts when something's out of place, but they instead feel anxious and that something is wrong or bad and needs to be made right. Some common obsessions that occur within Symmetry OCD include the need to order things, an obsessive need for evenness, things needing to have an even number or all be the same, the need for visual perfection, the need for balance, and a concern that something terrible will happen if an object is uneven or imperfectly aligned. Common symmetry compulsions include lining things up, repeating behaviors so they're performed equally on both sides, like washing dishes, putting on shoes, touching objects, positioning items so there's the same amount of space in between them, ordering or arranging items by color or size, rounding numbers up or down to make them even, repetitive checking or rewriting, or asking others to straighten things up, counting while performing actions to leave off on an even number, like walking or writing an even number of words. What are some examples of symmetry and ordering OCD effects on life? One way that symmetry OCD can start to negatively impact your life is being late to scheduled activities due to performing rituals that have to be done before leaving the house. This might look like lining up all of the shoes or noticing a dish out of place. People with Symmetry OCD might be impacted by poor work and school performance due to turning projects in late. This could be attributed to the perfectionism that's caused by the obsessive thought. Not only might the person with Symmetry OCD be chronically late due to fixing rituals, but people around them are often stuck waiting for them to leave. They may need to implement everyday accommodations like slip-on or Velcro shoes in order to avoid the obsessive and tedious need to tie shoelaces perfectly. This can also result in poor self-esteem when they notice imperfections in their face or body symmetry, and this can lead to disruptive checking rituals to see if the asymmetry is still there. How is Symmetry OCD treated? Symmetry OCD is treatable. The gold standard treatment for all types of OCD is exposure and response prevention, or ERP. And many people find that medication can aid in their recovery as well. An example of ERP might be for a therapist to purposely put items out of order and leave them that way until they habituate or get used to it. Response prevention could also consist of learning to resist the ordering and arranging or checking rituals. OCD medication can help decrease stress by reducing obsessive thoughts' intensity, frequency, and duration. If you'd like to learn more about medication for OCD, we linked a video we published on medication for OCD in the description below. Cognitive behavioral therapy, or CBT, can also help people learn to be more flexible in their thinking and behavior. CBT can be especially helpful for those with obsessive fears that harm will come if they don't do the rituals, and the fear that they may wish harm on themselves if they can't fix their thoughts. How to get treatment for Symmetry OCD. If you suspect you have Symmetry OCD or any other subtype of OCD, ask your doctor for a referral to a licensed therapist who specializes in OCD. You can also use an online therapist directory and further online OCD resources, including how to find a therapist that meets your Symmetry OCD needs. The International Obsessive Compulsive Foundation is a wonderful resource for information about all forms of OCD, including symmetry. We will include all of these resources in the description below.